Good afternoon. Welcome to the daily briefing at St. Clair County EMA office, where there's a lot taking place. Chairman Kern, I know yesterday you were busy working with legislators, and again today. So why don't you bring our followers up on the latest and not so greatest?
Well, we got, and we were all part of a call today from the Illinois Department of Public Health that's detailing what has happened since the region, our Region 4, which consists of Bond, Clinton, Madison, Monroe, Randolph, St. Clair, and Washington counties. We now have hit a third day above 8% positivity rate in the region. And so the Illinois Department of Public Health and the governor's office announced some limitations to try to stop the spread of COVID in this region. And so it doesn't go all the way back to what we remember as phase 3. I think it's tweaking what is going on right now. So basically, what they told us on the call was they're going to be limiting bars to table service, and those tables will be limited to 6 people or less at each table. You will no longer be able to be up at the bar. They feel that environment is conducive to the spread of COVID, given that if there's music, people talk loudly, there's more spray that goes on, so they want everybody sitting at a table. In addition, they're talking about taking reservations at restaurants and bars, and I think basically the purpose of that is to provide a log of who's there, so in case someone does come down with COVID who has been in a bar or restaurant, then they're able to track more easily who was there to try to isolate people so as not to spread the germ. The other thing, and probably the biggest thing of all, is that they are asking, or they are mandating, that bars and restaurants be closed at 11 p.m. So that then mirrors what's going on the St. Louis side of the river in St. Louis and St. Louis County. So we won't see a big surge of people coming across the river to be here at after 11 o'clock as an alternative to the places that will close in Missouri. Now we'll all be the same. All bars and restaurants will close at 11. There are a number of other things like no dancing, no party buses, and those will all be posted tomorrow. The governor, I believe, will be having a press conference tomorrow somewhere, hopefully in St. Clair County, where he'll be addressing some of these things. And so we'll just work with this, Herb. The numbers are there. We've seen it coming. But I will say, the good news is in St. Clair County, our positivity rate, as we run those numbers, continues to actually go down from where it was starting in March until today. We have always had a high positivity rate. I think a lot of this goes with the amount of people you test. It's pretty clear that when we test more people, we have lower numbers, so we're going to continue along with our state legislators and senators who were on the call today to push, and they were pushing on the call for more testing to come to St. Clair County, and we'll be working on that with them. Together, I think we get through this, but this is a change, and a change that's designed to try to slow the spread of COVID-19.
Well, the other thing I think it's worth mentioning is that the 14 days that we're going to have to maintain in order to get back to instead of the 8% rate, it's going to be 6.5% for a 14-day period.
So in order to go back to where we were, or where we are yesterday, or where we are today, because this goes into effect, I believe, Tuesday, to be able to get back to the normal phase 4, we have to then have 14 days of 6.5% positivity in the region. So that sets a higher bar than we've been, that normally has been set. And so we'll see how that goes. But as of now, this is what the state wants us to do, and this is what we'll be enforcing. I know they're going to set up a call with us, with the State Liquor Commission, with the Gaming Board, the State Police, so that they're all going to be assisting in enforcement, which likely is not going to be required because I think everybody is going to understand these restrictions. And we've seen a huge amount of compliance in St. Clair County for the current guidelines, and I expect to see that in the future.
Okay, Barb, we're here with Barb Holt, Director of the St. Clair County Health Department. Barb, you've got the numbers for today. Welcome on a Sunday.
No, absolutely. Today I wore this mask because my friend got me this mask because it looks like the COVID virus. So, doesn't it?
Yes, it does.
Something different. Something different. Alrighty, folks. Well, today we are reporting 66 new positive cases in St. Clair County. There were only 654 that were tested, so that really pushed up our daily positivity rate to a little bit over 10%, 10.1%. So for totals for the county, we have tested over 50,000 folks, 50,426. Of those, 4,861 have been positive, and 45,565 have been negative. Very, very glad to report that we have no additional deaths for St. Clair County today. And also that we have 4,069 folks that have completed their 10-day positivity isolation period who were positive for COVID, so that's good. Statewide, unfortunately, the state of Illinois is reporting 18 additional deaths due to COVID-related disease today for a total of 7,744 deaths in the state of Illinois. They had an increase reported of 1,562 positive cases. So overall, state of Illinois has tested 3,366,851 folks, and of those, 206,081 were positive. Hospitalization rates specifically related to COVID in St. Clair County went down a little bit from yesterday. Yesterday was 51, today is 46, and we're very happy to report no patients on ventilators today. As far as congregate settings, Caseyville Nursing and Rehab has one additional case for a total of 26 cases and no deaths. Freeburg Care Center has 2 additional cases for a total of 4 cases with no deaths. And Four Fountains has 2 additional cases for a total of 109 cases and 27 deaths for today. Additionally, we are offering, as we said last couple of days, Department of Public Health is coming in to do testing this week. So on Monday, we'll be in Shiloh at the community park from 8 to 4. This is a drive-through. On Tuesday, we'll be at Belleville West High School in the back parking lot. This also is a drive-through from 8 to 4. And then on Friday, we'll be at Moody Park in Fairview Heights from 8 to 4 as well. So again, our message has been, and as the chairman and Herb have reported, that we've moved up. Our positivity rating for our region has moved up, and we just can't reinforce the importance of wearing these masks. So please do so. And with that, I will turn it back over to the chairman for the zip code report, sir.
Great. Thank you, Barb. So we've got questions and answers today, so we'll zip through the zip codes pretty quickly so we can get to the answers to your questions. Remember, these are the zip codes in St. Clair County with the numbers of COVID positive people. These are cumulative numbers that we've been tracking since early on in I think April. So remember that when you hear these numbers. They go up and they can go down if there is movement between zip codes or from one zip code out of the zip code. So, and we do have one of those negatives today. In 62059, we remain at 10. 62201, we go up 1 to 201. 62203, we remain the same at 167. 62204, we go up by 1 to 125. 62205, we go up by 2 to 169. 62206, we go up by 2 to 369. And 62207, we remain the same at 219. In 62208, we go up by 4 to 314. 62220 goes up by 3 today to 388. 62221 goes up by 3 to 443. 62223 goes up by 10 to 258. 62225 remains the same at 19. 62226 goes up by 9 to 511. 62232 goes up by 1 today to 110. 62239 stays the same at 60. 62240 stays the same at 19. 62243 goes up by 1 to 38. 62254 goes up by 4 to 150. 62255 goes up by 1 to 14. 62257 stays the same at 26. 62258 goes up by 3 to 87. And 62260 goes down 1 to 80. 62264 remains the same at 72. 62269 goes up by 5 to 363. And 62285 remains static at 48. Herb?
Very good, thank you. Today is our question and answer day. So Brian, I know you said there was quite a few questions come in. We'll try to answer as many of them as we can. And if we don't have the immediate answers, we'll try to get you the answers to them.
Okay, thank you. We'll start down here with Barb for questions related to the health department. Barb, the first question says, I developed a sore throat last Sunday. I have no other symptoms. To err on the side of caution, I have stayed home. Am I okay to go out after 10 days if I still have a sore throat? Or should I wait till I have no more sore throat?
Again, well, it's good that you were staying away from folks if you are sick, but my best recommendation is call your medical provider because don't know the rest of your history, what may be causing your sore throat, or if you have fever. So we recommend calling your medical provider with that.
Okay. The next one says, what metrics will you be using when you reassess and give your recommendation that schools can reopen? I realize you did not mandate this, but most schools' legal counsel and school boards will only consider doing what is recommended by the health department. So for parents, what is the game plan, or what do we need to see data-wise to move in that direction?
Again, as we saw today, and for the last several days, our positivity rating for the region has been going up. This data drives our recommendations. These are CDC guidelines, scientific data that helps give a better understanding what's going on into the community. Obviously, that needs to drop, and according to the latest recommendations from the governor that will be starting on Tuesday, for us to get back into the safe zone for Region 4, it needs to drop to 6.5 at this point. Those are the recommendations at this point. Now, for schools, it'll, again, depend on where we're at with the rest of our information in St. Clair County itself. So we use several different metrics to try to give our best recommendations to the community.
Okay. Next question says, are the tests conducted in St. Clair County antigen or polymers chain reaction tests? If antigen, how reliable are the tests? I've heard of many instances of people receiving a positive test only to test negative a day or two later. We've also seen that recently in the media and with high-profile athletes and politicians. Given that hospitalizations and deaths have not kept pace with the case increase, is it possible that our data would be inaccurate? If it is the case, can we use PCR tests to confirm the reliability of the antigen testing?
Well, first of all, the testing that we use for our testing clinics are the PCR, the polymers chain reaction test results. So we're testing the virus that may be active in your body at the time of the test. Again, depending on where you're at, if you've been exposed to the virus anywhere between that 14-day period from 0 to 14 days, if you test negative on day 2, you could test positive on day 13. So the test itself is only good for that time and your body and your situation during that test. The antigen test checks the antibodies, and that's a blood test that is done. So that's done by doctors at different hospitals and things.
And you've previously reported positive antibody tests are not included in our counts.
Right, we're not doing the antibody tests because those are blood tests. So we're doing the PCR.
Okay. Another question that came in for you is remdesivir still readily available for our area hospitals?
At this time, I really don't know how much they have available. We'd have to check with each hospital to know their stock.
Okay. And one more, and then we'll move on for a minute. Why does IDPH data for St. Clair County show 5,216 tests performed for August 2nd through August 8th, but on the daily briefings we have announced 7,617 tests performed during that same period?
How we test how we gauge our stats, how we come up with our stats, are the actual lab results we receive from the lab at the health department for St. Clair County folks. So that day, whatever, it's called an INED system. It's a computerized system that drops in positives and negatives. And so that's our proof that we have a lab report saying this is how many test results were submitted, and this is how many of those are positive. So ours may be different than what the state gets depending on when their time frame of when they're doing the test results, and obviously with data there's a cutoff point in time when we'll report those.
Okay. Chairman Kern, a couple questions that have come in for you. First one says, are you aware if Belleville is working on a mask mandate similar to some other surrounding cities?
So I know East St. Louis had been talking about a mask mandate. It probably is more likely that when the governor came out with his latest executive order, and he put the requirements in for businesses to make sure that their patrons are complying with wearing masks, and made that enforceable, and had certain fines that went along with those issues, that might have made moot any city plans to have mask mandates. But I haven't heard of anything in Belleville being proposed. But the governor's executive order was pretty clear on wanting people to wear masks.
Okay. And the next one says, our positive cases are increasing. How are individuals being held accountable? At the Belleville Sportsplex, they had basketball games on Saturday, and many people were not wearing masks or not social distancing.
So, the Sportsplex is a business. They should be abiding by that executive order. In addition, I believe on the 15th of August, the state came out with sports guidance, and those all remain in effect and should be followed. There's a lot of contact that takes place when playing sports. We're hearing now, about the Cardinals and the issues that we've had. Now the Cincinnati Reds, it appears, have a COVID positive. Sports activities, the state's issuing those guidelines, and we really encourage people to follow those, because the spread of COVID is real, and it's something that hits everywhere, even with those who are athletic and have great systems. It hits everybody.
Okay. One more, Chairman, while we're here. The next one, and you kind of have addressed this as we started today, but the person wrote, how will the 3 days over 8% be addressed? Is this something that will come out Monday? Where and who should we be watching to make these changes?
So we will be posting the complete set of rules and guidance that came out from the Illinois Department of Public Health today. And basically, we are going to be under this new set of rules until we move 14 days into a 6.5% positivity or less for the region. So it appears we'll be stuck with this for a little while until we get our numbers where the state wants them to be.
Okay, thank you, Chairman. We'll come back down here to Barb Holt for a few more questions for the health department. The next person wrote, if I'm around someone who later tests positive, but while I was around them, we maintained the appropriate social distance and both wore masks, will I be considered required to quarantine?
No, it depends. The rules are if you've been within the last 48 hours of when the individual tests positive, last 48 hours of when they either took the test or became symptomatic, if someone was within 6 feet for 15 minutes or more, then they would be considered to be quarantined. And that if they were within that 6 feet for 15 minutes or more, doesn't matter if they wore a mask or not, because we can't ensure how well people wore their masks. But again, we don't want to take any chances. So it depends the time frame, and if they kept their social distancing and it wasn't longer than 15 minutes, then probably not.
Okay, thank you. The next person wrote, I heard the FDA approved a saliva test. How long will it be before we could have this in our area?
We hope to. I know the University of Illinois has been providing saliva tests to their students, And I don't know if that's totally FDA approved for general population yet, but as soon as they do, we hope to have that in our toolbox as well.
Next person writes, has the health department recommended remote learning to colleges and universities? Mine says they haven't received any of those recommendations.
When we sent our press release out, I believe it was August 7th, that Friday, we recommend that all students all schools consider remote learning. And again, every school is different, how much space they have, how they're able to separate and do the social distancing and trying to meet the recommended guidelines, so that it was recommended, encouraged to all schools that students go remote.
Okay. The next person wrote, why does a positivity rate even matter when these mutations are not near as severe? Hospitals are empty and we have very few on ventilators, and that is what should matter. Positivity numbers are only accurate when everyone is tested. With common false positive tests or many not getting tested, do you think the positivity rate is an inaccurate way to research?
Well, again, this is all based on science. These are CDC recommendations, science-based recommendations, and as far as hospitals, we report every day. I mean, we have 41 or let's see, 46 folks in the hospital today with COVID-related disease. That's 46 too many.
That's in addition to everybody else that's in the hospital for
other reasons. Yeah. So again, that's good we don't have anybody on a ventilator. If anybody's ever been on a ventilator, it's not a pleasant trip. So we're very, very glad that they're not on vents. But I'm sure if you ask anyone that has survived after being on a ventilator for an extended period of time, it's a rough battle. It's rough.
But that's not necessarily accurate. False positives are not a common occurrence. That's a very rare thing. There can be false negatives, but the false positives really are very rare. I think the governor in Ohio had one, and they made a big point of saying that that's an uncommon thing.
Absolutely. And again, people need to remember that that test is for that day at that time, and it can change in the next time you get tested.
Well, I think it's worth, when you're talking about the hospitals, it's called being proactive instead of reactive. Mm-hmm. Not like you said, not only are there other patients that are in there being treated for other illnesses, we have these COVID patients in there, but the hospitals have to look at it from a point of view of what happens if we have a disaster. What if that disaster the other night, Marissa turned in and we end up with 100 people that was injured, having to go to the hospital? That's why they have to prepare to make sure that they have enough beds available for everything above and beyond what these COVID patients are doing.
Absolutely. And that's why on a daily rate, pre-COVID, the hospitals always report their bed rates for the region to everyone. So in the event of a disaster, they know who has capabilities of taking care of whom.
Okay. The next person writes, is there a correlation between COVID-19 and blood type? I've been told that O positive is more resilient against the virus, but that you, of course, can still catch the virus. I have also experienced over 16 people testing positive for the virus, all of whom had symptoms, but 3 people in the same group who were just as much or even more exposed tested negative and never developed symptoms. Coincidentally, they were O positive.
I know there's a lot of research. This is a new virus, and we're looking at all kinds of factors with this, and it's still new. There's a lot of research. I know there was something that I read about that's a possibility, but there's no proven research that's if you're O positive that you're safe. Please don't think that.
And one more while we're here. Person writes, why has the number of ventilator patients declined?
I think that's a great thing that the number of ventilator patients has declined. Obviously, they're not as sick, and I hope it stays that way.
And also, I think when the doctors were here, they said that they're not using that treatment as much as they did. They learned that putting people on vents right away isn't necessarily the best course of action, and I think there are other alternatives to that.
Yeah, and as they learn more, again, it's a learning process. That was one of the first things they did, was right away put them on a vent, but that remdesivir and other drugs and things that they found seemed to be helpful.
Well, and one of the other things we're looking at is the younger population is being affected now, and they are healthier, and so they're not requiring that aggressive treatment. So, I'm like Barb. It's a good thing that I hope we never have to use a vent.
And it depends on each, if someone already has COPD or some type of longer respiratory issues that they come in with, obviously they're compromised to begin with, so more need possibly for a vent.
Director Simmons, a couple that have come in here that for you. First one says, why are grown adults being so hard-headed? If they wore a mask, we would be over this most likely.
If I had that answer, boy, I'd be able to answer it for him. But we've been preaching that for months now, and we see that there are, as the chairman said, a good percentage of our county residents are taking the warning, but there are still those people out there. And I wanted to bring up, the people who are trolling this page. For those you good Team St. Clair members, don't pay no attention to them. What I have found out, those are people who are living a sheltered life, and they just want to come on here and try to get you upset, and it works sometimes. But stay focused, wear your mask, and even though we're taking a step backwards now, we're going to get through this.
And this next one kind of goes to your statement there about taking a step backwards. The person writes, can you explain to viewers that we are not essentially going back to phase 3. Instead, we are entering a tier process in phase 4 of additional mitigation strategies.
Well, and I think that's a good thing. I was excited about the information today because if we would have went back to that tier 1, it was a lot more restrictions that they could have. But there was the asterisk on there that said, depending on what all the other metrics were, we're not going back to phase 3. Now, we're going to go up tomorrow in numbers again, probably for the next couple of days. I think we predicted that today. But as the chairman and Barb said, these new rules that are coming out, we can get by with them. But if we continue to go and we continue to see those increases, I can guarantee you we're not going to be happy. Nobody's going to be happy about it if we go back to phase 3.
The next person writes, how long will we stay in these new mitigation tiers?
Well, as the chairman said, our new metric is going to be that 6.5, and we have to maintain or be below that for 14 consecutive days. That's going to be hard to do if we don't get a handle on this. So if you think it's been rough for the last several months, 14 days at 6.5 or less, we're in for the long haul.
Okay. We'll come back down to Barb Holt for a couple more questions here. Health Department is obviously a popular topic here during COVID-19. This next person writes, when visiting with family that you do not live with, should you still wear a mask and social distance?
Absolutely. Wearing the mask, social distancing, washing our hands helps protect each other. And of all people, you want to make sure you protect your family members, regardless if you live in a household or not. So absolutely, wear your mask.
Okay. The next person writes, you made a recommendation for schools to go remote learning. What can we do about bars and youth sports tournaments? It seems like we're being reactive instead of proactive. I just feel if bars are open and kids are playing sports, the kids should be in school like some of our neighboring counties that have even higher positivity.
Again, with the schools going remote, that was the recommendation. I think several have done that. As far as bars and other places that we've found where it appears people are gathering and not wearing their mask, that's why we have these new rules to follow. And we've had also under sporting events, we've had several outbreaks associated with kids' team sports. Schools are restricted on what kind of sports they can have for the fall. There's new metrics on the sports, so they're the non-contact tennis, golf, I forget what the other
And those
were.
new sports metrics, not only do they apply to schools, they extended to like parks and rec programs,
Yes.
or even adult pickup leagues and stuff like that.
They
So
have.
it wasn't just isolated to the schools. They saw that problem in sports leagues, and as the chairman mentioned, those went into effect on August 15th, and hopefully that helps solve some of those problems.
And the other thing, what we did see is parents, early on when Illinois was more restrictive in protecting our kids and not allowing kids to have sports, parents were going to St. Louis and kids were playing in ball leagues and things over there because they were less restrictive.
Okay, the next person wrote, what medications are the hospitals treating COVID patients with, and what are doctors prescribing for ones that do not require hospitalization? Next, and it's a two-part question. They said,
Okay.
also, can you tell how many have survived after being on a vent?
Again, I don't have that information. I'm not a doc. I don't know what hospital medications are using and specifically how many have been on a vent or not. Sorry, I don't know, folks.
All right. The next person wrote, it was put out there by someone I know that there is an app that alerts you on your phone if someone is close to you that had or has COVID. They say if you go into settings on your phone, go to Google, there will be a red dot and listed as a COVID-19. Is our health department in Illinois set up to do this? I checked the app on the Google Play Store, and there it only says it's for Virginia.
Yeah, that's my understanding, that we don't have anything here like that in Illinois. What we do have through our contact tracing and our new Salesforce capabilities, you're able to contact us if you so choose via text, via your cell phone, and on a daily basis letting us know how you feel and reporting back to us that way rather than a phone call. So that's only with your approval. Turn your phone on and we can access you that way, but we have nothing like this for Google Play that I'm aware of.
Okay. The next person wrote, can you provide information regarding the statistics on detention centers such as the county jail? I understand we report on assisted livings and nursing homes in congregate living category, but are these excluded from that type of report?
We have been in contact with the jails and with detention centers, many other congregate settings as far as how to handle positive cases and isolation and quarantine and what they need to do, or helping them with testing. At this time, I don't have the statistics, though, specifically for the jail or detention center.
Next person says, your recommendation for schools was made because of high positivity rates and warning levels. At what positivity rate or how long in the stable blue category would it take to reevaluate those decisions?
Well, one of the things for St. Clair County, we did move out of orange into the blue category, so that was good because we ourselves as a county have really worked on getting testing and our positivity rating down. So we have moved back to blue. As far as a region for that positivity rate, as the new rules that come out on Tuesday to be moved back into back to phase 4, full phase 4 without these tier 1 guidelines, we need to bring that down to 6.5, and that's going to be tough. As far as guidance for schools, again, we work with IDPH and the schools in our most current scientific information we have to try to give us the best guidance on how to handle schools and at what point we need to open those. So more to come on that.
Okay. The next person writes, for the Shiloh testing site on Monday, one post said it was going to be a nasal swab. The other post said it was going to be a throat swab. Can you advise which one is correct?
We have several of these because we have two different testing groups that do testing. So one does nasal, one does oral. So when we have clinics that with Southern Illinois Healthcare Foundation that provide our clinics, they do the oral swab. For the test sites we have next week with Illinois Department of Public Health, they do the nasal swab. So the ones in Shiloh, Belleville, and Fairview Heights will all be the nasal swab next week.
A couple more here. Person writes, if a fast food restaurant has 3 cases of COVID in their facility, are they required to close?
It all depends. I mean, it depends on, if the folks that were positive, when they worked there, were they in contact with the other folks, what kind of, job they did, however else needs to be quarantined. There's a lot of factors that go into that. We've had different facilities just voluntarily close because after we do the contact tracing, a lot of their staff are quarantined, so they just don't have enough employees to work. So we evaluate each situation. There's not a magic number when they have to close. It's more of who need to be isolated and who needs to be quarantined.
Okay. The next person writes, it seems every day we have more and more reported cases. Yet everywhere I go, I see 100% of people wearing masks. Can you explain why cases would rise even though 100% of people are always wearing masks?
I want to know where you live to see 100%. That's great. That's great. People are wearing it. That's exactly what we want to see. But no, not everyone is wearing masks, and not everyone is doing the social distancing or the hand washing as they should do to help prevent the spread of this disease. So absolutely, people need to wear their mask, and they're not. It's obvious. You can drive down the street. I was just walking down the street, coming over here from the office, and there were 3 teenage kids walking down the street, and I said, "Hey, you guys got a mask?" And no, we don't need it. We're outside.
Well, as you've reported before, we're seeing a lot of cases come from private social gatherings people are having at their house with large numbers of people that maybe this person wasn't invited to see that, but
Right.
trace back, and you're finding several positive cases because people think, well, I'm at a house, I'm with my friends, I don't need to wear it,
Right.
and then the following week you've got dozens.
Absolutely, and within your own family too. You know, everybody goes out to work, goes to the grocery store, comes back, and you can be asymptomatic and not know. And even within your own household, typically one person gets it, it either spreads through or everybody's going to be quarantined. So absolutely, people need to continue to wear their mask.
And if you are experiencing any symptoms, even if you haven't gotten a test or feel the need to get a test, stay home. Don't take the risk with your friends that you're going to be impacting them and giving them COVID. Even with the mask on, if you're experiencing symptoms, you should stay home.
Absolutely.
Just especially during this time.
Right, and it's not just driven by a fever. You know, there's cough. There's several different symptoms. And again, you could be asymptomatic and not have any symptoms, and can still spread the disease to your friends and loved ones.
And one last health department question here, and it's kind of a loaded question.
Sure.
How do you know who has been quarantined?
That's a good question. We do contact tracing, which means we call the positive individual and discuss with that person the isolation for 10 days of they're required to do that, as well as who have they been in contact with within the last 48 hours from either when their symptoms started or when they were last tested, and we get the names of those folks and then contact them as well, and those are the folks that need to be quarantined. So we contact them, send them a letter, and this is a law. This is the public health law, communicable disease law. They're required to be quarantined. And then we follow up routinely with those folks as much as we can, because again, like everybody else, we're very busy, but we call and try to follow up with those people to ensure that they're following the guidelines. Worst case scenario, especially for positive cases, if we need, we have a plan in place with the state's attorney's office to ensure that those folks are isolated and or quarantined as needed, because it is state law.
Okay. Thank you very much.
You're welcome.
Chairman Kern, a couple more questions that have come in for you. Person writes, do we know why Freeburg closed their pool?
Well, Illinois Department of Public Health regulates swimming pools, so I don't really know why Freeburg closed their pool. This is the time of the year when some pools close. There are other reasons a pool can close other than COVID-19. And so I would just suggest that perhaps you call. I know Tony Funderburg, I think, follows this the EMA page and follows these programs, and so maybe you call Tony at the Village of Freeburg, and he might be able to enlighten you.
Okay, and the next person wrote, as a small business owner, if I have a customer who refuses to wear a mask and refuses to leave my store, what procedures do I follow to have that customer removed?
So you are, in control of your store, and certainly the governor's executive order requires mask wearing, and you, as a store owner, are responsible for that. If someone is not complying with your wishes in the store, then I think that you call local law enforcement and have that person removed.
And then the last one says, why aren't we hearing from municipalities? Aren't the mayor and police chiefs the ones enforcing these rules?
So we're all a team, and we're all part of Team St. Clair. The mayors have been very active. We're going to be on a call with them tomorrow. The police chiefs, all of the health department officials, we're all together in this thing. So if you're not hearing from them, it could be that maybe you don't live in their municipality, because a lot of them communicate with the people who live in their communities via Facebook, via Code Red, whatever it is. But I can assure you that for a large part, and I can even say about 100% of the police chiefs and the mayors in this county are doing a great job, and they're working hard to make sure these rules are enforced, and they're trying to keep everybody safe.
Okay. We're joined by Susan Sarfati, the St. Clair County Superintendent of Schools. And we had a couple school questions that came in today, so we wanted to run those by you. The first one says, why aren't schools included in the expanded mitigation tiers? Does it remain the discretion of the district and the superintendents about in-person learning?
Well, those mitigation rules are developed by the governor's office and IDPH, so why schools weren't included, I really don't know. But we are just going to follow whatever comes from the state.
So as of right now, there's no change in your procedure. It remains a local decision for those districts.
Correct.
Okay. And then the second question was, if we would go back a full phase into phase 3, would there be any change to the schools?
If we go back to the full phase 3, I believe there would be a change. It would be a mandated remote learning.
Okay. Thank you, Susan.
Yes, thank you, Susan, for coming in on Sunday. And we knew there'd be some questions about the schools, as there always is. And we appreciate everybody taking the time. I know there's a ton of questions that came in, but we could only answer the ones that came in through the portal. That's why we posted up the day before. We will try to answer those tonight for you, or get you the answers for those questions. There has been quite a few followers on here today. We said today that we were going to be at 8.5. If our number stays tracking the way we've got them lined out here, tomorrow will be 9.1. And I hope we can come on here and say it was wrong. But right now, that's what it's showing, a 9.1. You've heard what we've been doing. Our daily positivity rate today was 10.1. So we got to do testing, got to wear those masks, and just hope for the best. And if everybody, as I say all the time, is part of the solution, not the problem, boy, we can get by this. Going back to that question about why, and I got to say, it's just not adults. These young people out there, that age limit that 20 to 29 is what we're tracking. We got to get a way to get them, and hopefully these new restrictions will help ease that, and we'll move forward. We'll be back shortly with Daisy to translate this into the Spanish communities, and then we'll be back tomorrow afternoon with our next daily briefing. Thank you and have a good evening.